And again, I would like to invite you to today's webinar, which is on seeing possibilities, how technology is empowering people with low vision today. We're thrilled to be joined by Christy Alfario and Peter Cracknell from Quantum Reading Learning Vision. Christy is an Australian board-certified orthoptist with a diverse background spanning clinical hospital and community settings. She has worked extensively with individuals experiencing vision loss across various areas in New South Wales and now brings her expertise to quantum reading learning vision as a low vision consultant. Christy specialises in assessing clients' functional vision needs and recommending tailored assistive technology solutions to enhance daily living. Christy is passionate about bridging the gap between vision care and assistive technology, fueling the delivery of her tailored support, personalised training sessions, and empowering people with macular disease to remain independent and confident in their everyday lives. Peter Cracknell is the Manager of Vision and Blindness Technology at Quantum Reading Learning Vision. Peter's primary role is to bring the best assistive technology products to Australia, making sure they're properly supported with training and technical advice. Starting with Quantum in 2002 as a vision technology specialist, Peter previously worked in Sydney and his hometown London in the same field. Peter was instrumental in supporting MDFA at its inception, with Quantum being a proud supporter of the Macular Disease Foundation Australia since 2002. Over the years, Peter and his colleagues have collaborated with MDFA with webinars, workshops, and roadshows. On one occasion, this even included a marathon 3-week trip in 2005 to over 20 towns across northern New South Wales and all the way up the Queensland coast to spread word to local communities about macular disease management and how assistive technology can help improve quality of life for people with low vision. So thank you so much, Christy and Peter, for joining us today. I can't wait to hear what you both have to say.
Thank you, Delaney. That was a very lovely introduction. And good afternoon, everyone. Hello. Thank you for joining the session today. I hope everyone's had a great day so far. And as Delaney mentioned, my name is Christy, and I'm a low vision consultant based in Sydney, and I'm a part of the Quantum RLV team. So we do have lots to unpack today with our beautiful topic. It's a personal favorite topic of mine because I do love sharing people's stories, and I truly believe that the Quantum team is making massive changes in people's lives for the better. So let's unpack this afternoon and start off with a quick overview with today's session. So firstly, I'm going to be talking about who Quantum is, what we do, what aids we offer, and what is available, as well as a little bit about our team, what's new in the vision space with a few different devices that the lovely Peter, my colleague, will show you in a live demonstration today. And then we'll also touch on technology trends and innovations. And following that, we will then have a look at how you can access our services and support, and I will provide some contact information. So if everything sounds great, we'll kick into the session. So we'll start off with who Quantum Reading, Learning and Vision is, or Quantum RLV for short. Sometimes that can sound a little bit like a mouthful, so yes, I will be continuing on with referring to Quantum RLV for short. And yes, so we have been assisting people and delivering services to people with low vision and vision loss for nearly 40 years now. And we're a national organisation, and what we do is provide assistive technology products and services to people with print disability. And when I mean print disability, I'm referring to people and including people who have low vision, blindness, or learning difficulties. And beyond products, one of the best things, if not my favorite thing about Quantum, is that we get to talk to people of varying ages, varying levels of vision loss every day, face to face, and We really do care about providing you the time to tell us your story, your vision struggles, and what your reading needs are. So we really value that face-to-face communication. And we do this by offering assessments or otherwise consultations. So we understand that for some people, traveling to a centre is not an easy task for everyone. So we primarily like to offer first and foremost home visits. So we will come to you for an appointment with us, but we can also see you at one of our site support centres or showrooms as well. And majority of our team is based in our head office in Sydney, where we have our support centre located in Thornley. And the rest of our team is actually spread out interstate. And we do have our showrooms in Melbourne and Brisbane. So yes, if I'm talking to anyone here in Melbourne or Brisbane, please come say hello. Come say hello to me in the Sydney's showroom. We're always happy to have a chat. And so yes, a unique fact about us and our team is that we're actually a small team of 16 people. And this is our lovely team on the left-hand side of the screen. If you're able to see, I've got a picture of every single one of them. And one of my favorite things that I love when working in a small company is that I actually get to remember everyone's names, which is great. So I'm going to take the opportunity today to acknowledge everyone in my lovely team. So starting from the left-hand side up into the left upper corner, we've got Rachel, then we've got Rinny, Peter, Dahlia, Pip, Leon, Stuart, the accountant, then we've got Beck, Rob, Leanne, myself, Stuart, then we've got Nick, Adam, Joe, holding a really nice puppy, and Ange. So all of us together, we...
In Victoria. We've also got Kim starting in Victoria as well.
Oh, yes, you're right. Yes, Kim is a new starter that just came a part of our team a couple of days ago. So yes, I've got to put Kim's picture in here as well. You're right. She's probably not going to like me and having to ask her for her first picture. But yes, we do have Kim who's joined our customer service team. And all of us together, we do make the customer service team, the warehouse team, the consultants team, and management team. We all come from different backgrounds and we all bring a wealth of different experiences, both life and work experiences. And we take all of that knowledge and all of that care and provide it to all the people we interact with in our role and with our clients from day to day, as well as our friends in the vision space. So in the vision space, we collaborate very closely with the teams across Vision Australia, guide dogs as well, of course, Macular Disease Foundation, and as well as our friends over at Seeing Differently and Visibility. We also work alongside optometrists and ophthalmologists, so eye doctors and people who prescribe glasses. We do tend to get referrals from them as well. And we also get referrals from allied health professionals. So these are people who are occupational therapists, orthoptists, and orientation and mobility specialists. And a main important thing to know as well is that we're also national distributors. We represent many of the world's leading suppliers in the low vision technology space. For example, we have strong ties with Freedom Scientific, who are the people that made JAWS and the ZoomText software. We also have ties with Optilect, SiteCare, Schweizer, Orcam, the team at Zoomax, and the team at Mountbatten, and many more. So in terms of what aids are available and what we offer, we currently have over 40 different devices available. So we like to cover a wide range of solutions. As I said, we really try to listen to our clients, and for future clients, we know that one solution might not fit another person's solution. So we really try to cater that, and we're mindful of that in our products, in our range, as one thing may not work for another person. So if I was to categorize the range that we've got lighting, magnifying glasses, electronic magnifiers, both portable and desktop. And we also have text-to-speech devices that can also aid people who are completely blind or who have severe vision loss. And any of these devices are on display at any of our showrooms in Sydney, Melbourne, or Brisbane. And the same goes for the rest of our range, which includes other products that can aid people who are completely blind, such as wearable devices, our braille devices, tactile graphics, and computer software and hardware options. So it's really a complete range from simple aids through to advanced technology. And our team tries very, very hard to help and choose the device that best fits their lifestyle and your goals and your level of vision, of course. I'm sure I can speak for Peter on this as well when I say that our roles are very, very rewarding. And I'd like to share with you all right now, if it's okay, a lovely couple that I met a couple of months ago who reminded me of why I do the work that I do.
This is Bernie and Jen. Bernie enjoys playing Sudoku. He's the friend you would call to learn which horse to place your bets on. Total lover's boy for his wife Jen. Full-time jokester for his 5 grandchildren. And he also has low vision. But if you ask him, he would tell you how his Clover 6 handheld and Clearview desktop magnifier have helped him keep doing the things he enjoys.
Oh, our lives would be so different if you didn't have those devices, for sure.
The paper, I get a paper every day, and the first thing I do every day is that. See that? I don't know what they look like, I can't see that. And if I go like that, I can see it. It's hard to explain when you're losing your eyesight gradually. Like, that's, sometimes you think, well, if I was blind, totally blind, I could get around with aids and people help me, but I was independent. I didn't want that. Yeah. So I needed things to help me get around.
When we go out to eat, he can read the menu. I don't have to sit there and read the menu for him, which was what we were doing before, because I'd have to go through word by word. So, or at the shopping, he couldn't go shopping anymore, and I was working and he was doing shopping. So things like that, he'd go over there and he'd be able to magnify and see. Often he'd still get the wrong thing, but and while Jeff was organising what we were buying, I got my photos out on my phone and showed Bernie under the big magnifier. It was the first time he'd seen the grandkids' faces, and that was a real moment.
See, I can't make them out. If I go like that, I can start seeing them, and now I know who they are. It's Evie, Sadie, Ollie, Chloe and Jake. Otherwise, so I'd never know what they look like. For people that have got visually impaired or totally blind, they can still do things if you get the right equipment.
And is that your one advice you reckon you would say for people that are also in a similar journey?
Yeah, you can't sort of sit there and do nothing. That people do everything for you.
Out of 10, how happy are you both with the devices?
Yeah, I'm 10.
Oh, 10 for sure. 11.
So yeah, that was a little snippet of who we are and the kind of things that we do, as well as our services. I love that video, and I love Benny and Jen for wanting to share their story. So I hope that put a smile on people's faces. As you can tell, I'm slightly on right now. Alrighty, so moving on into the next section, what is new in low vision technology? So I'll take you through 3 devices, a bit of their main features that I'll go through, and then Peter will show a live demonstration of all the devices. So starting off with the Snowpad by ZoomX. This has been a very exciting product that has rolled out recently. It's a device that really brings together the best of both worlds. If you use your own personal iPad or tablet, with this electronic stand, you can use your tablet as a digital magnifier with text-to-speech. So essentially, you would download the Snowpad application from the Apple Store for free. There's no cost to it. And then you would connect your iPad to the magnetic stand, and with a connecting cable, Then you can start reading your novels underneath the stand, for example, or writing your kitchen recipes, or even use the distance camera to look at wedding photos hung up in the living room. That's just from an example that I've seen with a trial with a client recently, which was very cute. You can magnify text and images inside the app with an easy on-screen control. And the device is able to read text aloud using OCR. So with OCR, just think converting text into speech, so written text into speech. And it's reasonably lightweight. I'm sure Peter will demonstrate that as well, compared to other portable electronic magnifiers that are currently available. And I'll move on to the next slide for another picture for its different uses. And we're seeing a lot of attraction for the device at the moment for people who are already iPad users. These are people that are just wanting a little bit of extra vision support, for example, to read their mail or to do their crosswords without having to switch between a completely new device. So it's enhancing people who already use iPads and making their life just that little bit easier without having to worry or stress about having to find a new device and learn a completely new features and everything. So it's very much tailored with people who have vision loss, and we're keeping that in mind. Here's another picture of the snowpad. And yes, it's got a dual camera, so a camera for the distance and a camera for the near. The near camera is actually the iPad camera. So it's utilizing the iPad's capabilities and its resolutions from the camera, which helps really make that crisp image that a lot of people appreciate as well. I recently was helping a client who is a first-year engineering student. He has an iPad Pro and he wasn't able to read all his physics calculations and everything as engineers do on the whiteboard and try to do his worksheet at the same time. So he loved this. But my favorite story so far is I had a lady who was 93 years old. Yes, 93, and she was a better user with an iPad than I was. She uses it for everything in her life. That's how she stays connected, and that's how she does her leisures, like crosswords, for example, and she loves to read the newspaper. She found using this completely useful, and yeah, I wish I had a video of her to show. Next up, we have the Cloverbook XL Pro. So this is a type of portable electronic magnifier that people do have to learn how to use. So in comparison to the snowpad, where it's familiar with your own iPad, that we just saw. In saying that though, the controls and the menu is designed for people with low vision. So we do have feedback from people with lived experience that the controls are intuitive and easy when you have initial training and some support as well. The main difference between the Cloverbook XL Pro and previous Cloverbook models is that you've got a larger screen. So the size is about 15.6 inches. If I'm wrong, Peter, let me know. And the screen can actually be hinged forward. So it's in the picture there, it's coming out to 90 degrees. And yes, that is a true depiction as to how the screen can come up. And we're getting lots of feedback with saying that's helping a lot of neck and back posture for people who are using it for reading their novels, for example. It's got true portability where you can move the device from room to room. And the Pro version means that the device can convert printed text to speech, which I've seen clients really enjoy when they're trying to read the last chapters of their novels. It is easily foldable. And you do have the option to use the distance camera as well to watch TV, for example, and the near camera to read your newspaper. So you can even do both of those things at the same time with the split screen mode. So it's very handy. And last but certainly not the least, we have the very new model of the blind shell, the Classic 3. The phone is purpose-built with vision impairment in mind. It has a tactile keypad phone that gives people who are blind or have low vision the power to use a smartphone without the complexity of a touchscreen and all the hassles that come with a touchscreen. So removing that complexity that phones have nowadays. Even for me as a young person, I get overwhelmed with everything that you can do now with your phone, and yeah, there's a lot happening. I'm an iPhone user for context. Yes, but the main thing that sets the Classic 3 model apart from previous models, which Peter will demonstrate as well, are all these support AI systems that are built into the phone. So we have Luna, which is the built-in voice assistant. So Luna can help you open apps, call people for you, and even set alarms. And then we have Tandem, which is a support app when you're on a call. And then we have Observo, which is an image describer. So if you take a photo using Observo will then describe the photo for you. I haven't trialed it yet with taking photos of people, but I can imagine that can get people in trouble if it's very, very accurate or descriptive. Yes, but I know Peter can share more if he wishes on this, as well as the other devices. So I'm going to pass it over to my lovely colleague Peter now for a live demonstration of these devices. So I'll just stop sharing my screen. There we go.
Well, thank you so much, Christy. That was a really good overview, and exciting to talk about some like really new products that we have that are doing really well. I think it's important to put it into the context of products that have been around for a long time and are still very valuable. And I think your clip of Bernie using the Clearview, which is what we call a desktop electronic magnifier, that was a really good product. It's still a very valuable product with a lovely big 24-inch screen. And you can see how easy Bernie was using that to do his reading tasks, his newspaper, his crosswords, looking at photographs. But one thing that is, like, if you like, a new trend of the last year or two has been a move perhaps away from the big screens. They take up a fair bit of room. Sometimes we have people say, look, maybe I don't need such a big screen, but I'd like to be able to maybe have it less obtrusive. It's not in my face all the time. I can put it away in a drawer, or maybe if I had a battery-powered version, I could take it, to my daughter's place when I'm staying for a while. Those sorts of things. Maybe move it from the kitchen to the living room, and that's a trend that we're seeing now towards more transportable devices. So the ones you showed, Christy, the Cloverbook Pro, XL, and the Snowpad, they're a classic example of a move towards what we call mid-size, more transportable devices. And of course, the other trend is, as you mentioned, that the Snowpad uses your own technology. It uses your own iPad. So a lot of people have iPads. They use them for all sorts of things. Why not use it as a magnifier? And that's where it comes in. So I'm going to demonstrate some of these things here now. Sorry, I'm just going to move the camera on a little bit to desk over here. So actually, I'm going to start with Snowpad because that's where you started, Christy. So when we talk about something being transportable, we're talking about something that is light enough for anybody to carry. Even school children can carry this. It has a handle, and of course it comes with a backpack and so on. But the really nice thing is that it's you can put it away in a drawer somewhere. And when you want to open it up, basically just just turn the camera down a little bit. So you just basically pull back on the handle and then swivel up the tray like this. You turn it around to yourself. Yeah, switch it on. And you'll see that it's using just a regular iPad. I've just got a little iPad here, but it can be an iPad Pro 13. It can also be an Android tablet as well. And basically, we stick a magnet on the back of the iPad, and just sticks to the frame, and it sticks really, really well. What I mean by that is when I'm shaking it and wobbling it, it doesn't fall off, which is important when you're moving it from room to room. And then what we do is we just use the iPad in the usual way, but we run an app, and the app is the Snowpad app. And I'm just going to, I don't know if you can see, I'll zoom in a little bit on that. There we go. And the controls are really simple. I have a little menu at the bottom, and these are large icons, so they're easy to see. And I can just change the cameras that I'm looking at just simply by pressing a button on the ribbon at the bottom. So now I'm using the iPad camera, which is just underneath here, and I can use traditional iPad gestures to zoom in. But in addition, I can change the colors, the background colors, so that the contrast is better, there's less glare and so on. And all of the features we'd expect on some of our traditional electronic magnifiers like the clear views and so on. But they're all on the iPad platform here. So anybody who's learned to use swipes and taps will be really comfortable using this here. And as you can see, it's just so transportable. We can move it to the kitchen to read a recipe. We can move it to the living room, to read some bills or something like that. And Christy, you mentioned that we had that it could be used for looking at television. And in fact, we did a really interesting project with the Macular Disease Foundation a few months ago, where we actually looked at some solutions for viewing television. And one of the things we tried out was this kind of arrangement with a clover book with a distance camera aiming at the television. So this is an example where something light and portable could be used for that purpose as well as crosswords and reading bills and that sort of thing. So this is the snow pad, just really straightforward to fold up, put away in a drawer somewhere, or just take in the car when you're visiting somebody and so on. Then we have the slightly bigger clover book, but once again, it has a handle and it's quite transportable. So it's about the size of what we call a gaming laptop. So it's just that sweet size where it's big enough for people with significant vision loss, but not so big that it's taking up the whole of your study desk. So once again, we simply just pull the handle, pull out the screen. Now, initially, the screen is on an angle like this. But one of the nice things about the XL Pro is that it's got a hinge so that we can now bring the screen flat. And that's exactly what Christine was referring to about, being comfortable, just ergonomically comfortable at home. So the screen's at a nice height, you're sitting up straight, you're not looking down over the device. The dials are pretty straightforward. There's one with a picture of a magnifying glass, which you might guess is to do with magnification. So that's exactly what it does. So here you can see my fingers, and you can see the print here. It's funny that whenever I do a demonstration of a book, I always open it at the page, which has got a steamy scene in it. So I'm hoping there's nothing too inappropriate here. No, I think we're okay. I think we're quite safe. So here, yeah, you can read the novels and your paperwork just by sliding it underneath. That's a point of difference with the machine that Bernie's using. He's actually got a sliding platform that moves. This one here, there's no platform. You simply just move the book by hand. You can also drag the image with your finger, just like on an iPad. So that's just another way of reading with this. So this one combines both the ability to use dials, and some people would like dials, and some people will prefer gestures like on an iPhone or an iPad. So this combines both these features. Also, as Christy mentioned, we can actually also ask it to read this page out loud. So that instead of using our eyes to read, we press a button and it will actually read it from top to bottom with quite a nice natural sounding voice. So this is the Cloverbook Pro. Now the camera for distance is actually on the side here. And it comes up like a periscope, and you just aim it either at yourself or across the room at the television and so on. So it's really quite convenient, all in one mid-size electronic magnifier. So this is about a 16-inch screen, which is a really, really nice size for people with macular disease. Not too big and not too small. I should just mention before I go on to the blind shelf, just in case we forget, that on the subject of text to speech, we also have some devices that all they do is read. And that's a classic example is the All Can Read here, a handheld text to speech device. So you're not using your eyes, you just take a quick snapshot with the device, you point it at your text, and then this reads it out loud for you. Now, the other device that Christy mentioned and talked about was the Blind Shell Classic 3. So what this is, it's a smartphone. It does have a touch screen, but it has some really prominent buttons in high contrast. So it's actually possible to operate it entirely with physical buttons. For example, I'll just turn the volume up, and it's very loud. Oftentimes people have a vision impairment and they have a hearing impairment too. So that's why this is nice and loud. But the thing you'll notice for somebody with low vision is the actual information screens are so large. And I'm just pressing a button to do that. And it has a very simple menu system, which I just go into. And everything's spoken, write an SMS. And so on. And I can just easily back up. I can go back to the home screen, all by pressing 4 buttons, up, down, yes, and no. Simple as that. And we find that some people who find the complexity of an iPhone just a bit too much really respond well to something that they can operate with their eyes closed and just listening to it. Now, it has a whole heap of very useful apps in it, calendars, timers, alarms, torches, and all sorts of things. In addition, though, this version, the Classic 3 that we just released, has got the Luna voice assistant. Now, this is just like Siri on the iPhone. You can actually ask it to do things. You can ask it silly things like tell a joke and all that sort of thing as well. What's the weather? But one of the really useful things that this can do with the Luna voice assistant, and this is something that Christy will see, all of us see all the time, is that people with severe macular degeneration really struggle to write down things in their diaries, like their doctor's appointments. They often have big calendars with big thick felt pens that they write in 2:30 dentist appointment. And that's critical because they've got to organize their day, their appointments, and so on. But they really struggle with their low vision to manage that. So this, with the Luna voice assistant, is one way of managing that. So for example, let's say, or I'll give you an example. So I'm going to just press a button on the side and ask Luna to do something. 14:37. Set a doctor's appointment for Thursday at 2 o'clock. Event saved. 14:37. So it's told me that it's saved that. But now let's say I'm thinking, oh gosh, hang on. Do I have a doctor's appointment this week? Luna, yes, you have a doctor's appointment on August 28th, 2025 at 2 p.m. So that's an example of where I'm using like a natural interaction. This is the sort of thing that people who are not so familiar with jargon and technology could really use to manage things like appointments and so on. And there's many, many other uses for that Luna voice assistant. Like, oh, send a text message to Christy. And so then it will say, what's the message? And I can dictate that. I don't need to type it. I don't need to do anything like that. I don't need to swipe or anything like that. So the Blind Shell Classic 3 will be really useful for people that they need some of the features of the iPhone, but they just can't manage the iPhone. The other things that Christy mentioned was the Observo feature. Now what this is you take a picture of something. So let's say you'd accidentally knocked over 2 bottles of pills, all right? And one of them is your heart pills and one of them is the pills you give the dog, all right? You don't want to mix them up. So what you do is you just use the Observo feature, you take a picture, and the Blind Shell will describe the 2 things you have in your hand. It'll say on the left is a white bottle containing heart medication, and on the right bottle is a red bottle containing treatment for the dog. So that's something you can do on your own. You don't have to wait for your daughter to come or anything like that. And it's important that you manage those things at the time on the spot. And that's where this phone can come in really, really helpful. And the tandem feature that you mentioned, Christy, you mentioned about remote support, which is very true, but it's also another way of doing FaceTime type communication. So if you want to be in touch with your family, even overseas, you can use your blind shell, and it's easy to operate. And so they can see you, you can see them, and so on, in a simple way, in a simpler way than if you'd try to do it with FaceTime. So that's an example of 3 of the devices, brand new, they've only just been released this year, and they're really exciting for us. Christy, how are we going for time?
We are running a little bit short on time, so I will see if we can go from here for a little bit of the trends and innovations, Peter. I think you touched on the first one a little bit, but if you wanted just to maybe just give an example there with the wearable trend, maybe, or the My Eye Pro, and then we can move on to the FS Companion, which I think is quite exciting.
Yeah. So the one thing that everybody's heard a lot about is AI, artificial intelligence, and good and bad, of course. But for people with low vision and people who are blind, it is already absolutely liberating. It's absolutely fantastic in many, many different ways. So, for example, a blind person can actually look at a Venn diagram online or in a PowerPoint presentation, and they can use their AI in their screen reader to describe it for them. Now, this is something we could never do before, and it's really opening up education, it's opening up employment for people who are blind and vision impaired. Of course, it's also very useful for all the things everybody uses, but it's particularly useful with our devices. The second point here is about the integration with low vision hardware. So I mentioned that we can read out documents using our devices like the Cloverbook XL Pro. In the past, it would simply read from top to bottom, and you'd have to listen all the way through the document till you got to the information you really wanted. So an example where now we can use AI in that same technology is we can ask it questions like, when is this happening? So for example, let's say you get a letter from the council and it says, on Tuesday the 17th, council will be digging up the road. You'll be inconvenienced for 3 hours between this and that. Now, let's say you wanted that information, you don't want to listen for 10 minutes till you got that information. You could use the AI question to ask it, when is the road being dug up? It would look through the document and it would say 2 o'clock on the 17th of September. So this is an example where it's been saving people a lot of time. It's summarizing things. Just as I said with the Observo feature for the Blind Shell Classic 3, that's summarizing what's in front of me. It's not describing the carpet and the paper clips. It's just saying there is a computer, there's 2 cylinders, there's a bottle, there's a cup of coffee, those things, but it's really summarizing in a really intelligent way. So I mentioned about the integration with the low vision software, the screen readers that blind people use to read PDFs and web pages and so on. It's absolutely liberating for those people. Another example is the Freedom Scientific Companion. Now, this is a chat bot that's been put into the JAWS screen reader so that if you can't remember a particular key combination or a command or a process, you can just simply ask it with a natural language question, either by speaking it or typing it, what's the command to do this? And it will give you that information without you having to trawl through hundreds of pages of manuals. These are hugely productive things for people who, whereas with good sight, we can glance down a page and pick out information straight away. But when you're listening to things, it can take a long time to extract the information you want. Yeah, so these are some of the wonderful things with AI. Trends and innovations going forward. So I mentioned that we're getting lighter and more compact electronic magnifiers. They give more working space. The example in the picture here is of a new product we're bringing in called the Lunar Eye. Now, this is a desktop magnifier. It's a 24-inch screen, but it combines some of the features that you alluded to with the other devices, like a camera that can be swiveled and aimed at your face or at your hobby work and so on. The small footprint, and this is a trend, as I was mentioning before about compactness, the small footprint frees up your desk so that you've got room for everything else. And it's not as imposing as having a big machine, as Jen referred to in the video clip, the big magnifier, which I think is such a great description, the big magnifier. These look more like a television or even a computer monitor just sat there. They look really quite in place and not like some huge bulky thing. Yeah, so that's something we'll be starting to put out there. Once we get stuck with it, the Lunar Eye from ZMax. Over to you.
Thank you, Peter. Thank you. Great demonstration. And yes, so before moving on to questions, I will just do a nice little sum up as to how all of you can access our services and our support. So the first thing to know about us is that we are a registered supplier for NDIS, My Aged Care, DVA, so the Department of Veteran Affairs, and Job Access. So, for example, if you are with My Aged Care you have a My Aged Care ID and a level package with, say, Anglicare or Australian Unity or Blue Care, how it would work to gain services with us is that if you had a device that you liked from us and are keen on trialing it, we can have a consultation with you. Our initial consultations can be free. And with your consent and you want to move forward with the device, we would then communicate with your home care provider manager and we would send them a quote and carry on the process with them from there. So we are supporting you along the way with that. In regards to accessing us, a lot of people do ask if they need a referral from us. You do not. Some people, like I said earlier, with allied health professionals or optometrists and eye doctors, they will see people in their clinics and then will refer to us. But you do not need a referral at all to see one of our consultants. And we do home visits, we do school visits and workplace visits, but you can always come and see us at one of our site support centres as well. We also like to offer ongoing support and training. So we don't just leave you after the purchase of the device. We are more than happy to support you to ensure that you have the successful use of your technology for you. And we love to work directly with everyone as well. In our community, we also, when we're not seeing clients, we like to raise awareness really of what technology and what solutions are out there. So we love doing community talks. We're very welcomed in aged care community homes. So if there's any managers or anyone out there in the crowd, we're more than happy to come out and share the technology with your community. More than happy to do that. Yes, so if you'd like to stay in the loop with our devices and what new devices are out there, and if you want to subscribe to our regular bulletins or mailing list, please feel free to contact us on our number here displayed on the screen, or you can always email us as well, and our lovely customer service team will connect you to the channels from there. Delaney, I can also send this as well over for people once I stop sharing the screen too, with your help after that.
Fantastic. Thank you, Christy and Peter, for that. That was so interesting and fascinating to learn about the devices that are available now, the huge range, and also, you know, what to look forward to in the coming years. So thank you so much for going through that. Just a reminder for everybody in terms of questions and how to send them through. Again, you can click on that Q&A button. For most people, it should be on a little ribbon at the bottom of your screen. And when you click on that Q&A button, it will bring up a white box that you can pop your question in and then select send. If you would like to send those questions in anonymously, you can definitely do that by clicking the tick box on the bottom left of the box before you send the question in. Before we get into the questions, I did want to talk very quickly about the Macular Disease Foundation Australia and the work that we do. Our goal is to try to reduce the impact of macular disease. First and foremost, our first pillar is prevention and early detection. So we provide accurate, current, and ongoing information to try to increase the awareness of macular disease nationwide. And we reached thousands of people last year, and we're hoping to continue doing this in the future as well. Secondly, support and services. So we provide support to all of those people who have been diagnosed or affected by a macular condition. We also support their family members and carers as well. And we facilitate access to other support services. So this includes our helpline, our peer support groups, and our iConnect service as well, which I'll touch on in a moment. Voice of the macular disease community. So we're very, very privileged to advocate in the best interests of the macular disease community, whether it's designing policies for state and federal government or making sure that medical benefits are not cut. And finally, research and data. So since 2011, the Macular Disease Foundation Australia has awarded $6.9 million across 42 Australian research projects, all with the hope of trying to increase the understanding of macular diseases. As I touched on before, our iConnect service is just one of the ways in which we provide support for people with macular disease. iConnect is currently available for anybody with age-related macular degeneration, and it will soon be available for people with diabetes-related eye conditions as well. The services include information about the macular disease, practical advice, and emotional support as well over approximately about a 12-month period or so. And this service is actually personalized to you. So it's personalized according to your stage or type of macular disease, your level of vision, and your need for social support. And it's completely free. And to access all of our services, including iConnect, you can call us on our helpline on 1800 111 709, or you can email us at education@mdfoundation.com.au, or you can also visit our website on www.mdfoundation.com.au. Whether it's questions about your eye condition or government services or peer support groups or even accessing our resources, we're here to help with it all. And finally, at the conclusion of our webinar, you will be receiving an email. So this email will contain a few different links, including where to reach Quantum. So I think Christy put up some numbers and links, so that will be sent through in the email for you. It will also include how you can sign up for iConnect and where to access all of our resources, such as Living Well with Vision Loss booklets. You're also going to receive a link to a survey. So this survey allows you to provide us with a bit of feedback on the webinar that you have just attended. We'd really appreciate it if you could fill this survey out. It only takes a couple of minutes, and your answers will allow us to improve future webinars and also to pick new webinar topics as well, so we can cater it more to your needs. All right, so I might go to the questions. We do have a few questions that have come through. Okay, so we have a question on supporting areas such as Adelaide and Western Australia. So how can people in these areas access quantum support and devices?
The way we work in South Australia and Western Australia is in collaboration with the agencies already there. So in South Australia, it's predominantly through See Differently and also Guide Dogs South Australia, Northern Territory. So we've had long established relations with those agencies. So we'll work with their occupational therapists and their assistive technology specialists, and they all already have some of our equipment, so they can use their facilities and their staff to demonstrate our equipment. They'll often call us, and this is true for WA as well, just if we have it's a specialized question or an unusual piece of equipment, we can often set up a video link and just either train them or send them equipment for trial and so on. In WA, of course, we work very closely with Visibility, which is the major agency there, and Vision Australia as well. They have an office there as well. So yeah, this is how that's those two states. In the Northern Territory, we work with Guide Dogs SANT. We also work with we have an agent up there in Darwin. She's an orientation and mobility instructor, and so she does home visits and so on. And so this is how we reach places outside the eastern seaboard.
Oh, fantastic! And I'm assuming it would be quite similar for Tassie as well.
I'm sorry.
Oh, sorry. That would be quite similar for Tasmania as well.
Yeah, that we cover that from our Victorian office. So
fantastic.
our staff there will visit Tassie and work with the agencies, including Visibility, who have a presence there as well.
Perfect. If someone is in a state near your showrooms, is it free to attend a showroom and to try these devices?
Christy, I'll let you answer that.
Yes, thanks. Yes, it is. We can also book by appointment. Any of our consultants can be through a call or through an email or calling our customer service team. It is for free to come and have an initial appointment with us and to see our products in person in the showroom.
Fantastic.
We can then, if that then goes to some kind of trial or assessment with an occupational therapist or an allied health professional, then we can quote for our time and equipment if it needs to go to that second level. But the initial visit is what we essentially call a scoping visit, and that's free. Though I should say, if you are coming to our showrooms, our site support centres, please phone us because we don't want to double book. So it's better to make an appointment.
Yeah, definitely.
Yes. In adding that for context, it's because we drive to go and see clients because we offer home visits. So as much as we'd love to always be 24/7 in the site support centres, we are also travelling. So yes, appointment helps for that reason.
Perfect. Someone has asked whether they're able to make an appointment with Quantum and try everything and master everything, but they don't have any vision changes as of yet. It's more that they want to learn and master everything before their vision changes. Is that a possibility?
Yes, it's we would rather see people at any stage of their vision loss. I always feel that it takes a lot of courage to pick up the telephone and first of all admit that you need help, but secondly to make an inquiry in an area that you have no knowledge whatsoever. So I would rather see people, for example, we see a lot of people at some of the low vision clinics run by the schools of optometry, for example. And these people are often at the very beginning of a low vision journey and they don't need our equipment necessarily, but they now have knowledge of it. And so it's less frightening. They're more willing to reach out and also reassuring that there is equipment that can help them should their vision get worse.
Fantastic. Someone has asked, well, there's a couple of questions actually. Someone has asked specifically whether the Snowpad can read different languages besides English, and someone else in extension has asked what devices can read other languages apart from English.
Yes, it's true. The Snowpad, because it's using the iPad, you can actually switch the system language to hundreds of different languages. And you could put a piece of something in Cantonese underneath or something in German as like a brochure. And not only would it understand that, it could actually speak it in German.
Fantastic.
So that it won't translate from German to English on Snowpad, but we do have a device that can do that, and that's called the All Can Read 3. So this little handheld one, the Read 3 version of this can connect to a computer, and then via the computer it can actually translate from one language to another. So you can actually take a picture in in one language, like French, and you can then have it translated into English and vice versa. So that might assist people with who English isn't their first language, and they're just trying to master that, or who are learning other languages. So that is an option there.
Amazing. This question I might actually try and answer. So the question is, does being a heavy computer user affect or deteriorate macular degeneration? I'm going to assume this question is about age-related macular degeneration. For that, there is no evidence to show that, using a computer or your phone or, watching TV has a significant impact on deterioration. Other forms of macular disease, let's say myopic macular degeneration, there is some evidence to show that a lot of near work may progress myopia. But for age-related macular degeneration, there's no evidence to show that. Moving on to a couple more questions. Someone has said that they have quite a large Samsung tablet. Would that still be compatible with the Snowpad?
I'd have to be careful and check with the manufacturer. I know that, for example, they're working on Samsung compatibility. At the moment, they have the Huawei, and then I can't remember the name of the other tablet.
The Xiaomi's.
Xiaomi, yes. But yeah, if we knew the model, we could ask the manufacturer whether it's compatible yet.
Okay, fantastic. I think this might be one of the last questions. Are all the devices that you've shown today available on the website?
Yes, in fact, the website's a terrific resource because first of all, every page describes fully the device, not just in terms of how many megapixels and so on, but also in the typical use cases. And I think it's important to have that at the forefront. Where would I use it? Is it suited to me, the things I do every day? Then the price is right there. So the Snowpad is $3,295, and that's right there at the top. Also, there is often some useful comparison documents, like you might put three in a range up against each other and compare the features. And it's all grouped by with categories. So whether it's suitable for people who are totally blind, or for people who've got low vision, or some kind of learning difficulty or dyslexia and so on. So the website, we like to call it the single point of truth. So that's where we want everybody to go, just for the information. Yeah.
Perfect. Sounds good. Well, thank you both so much for joining us. We really, really appreciate it. And I think I'm sure everyone that joined will agree with me that we learned so much, and we really appreciate it. So thank you both so much for joining us today. And thank you to all the attendees as well. I hope you found it informative, and we'll see you next time. Thank you very much.